Everybody's looking for lifetime care somewhere. Doesn't it make sense to really take care of the most important system of your body? Your nervous system controls everything. There isn't a cell that divides in your body that your brain isn't coordinating right now.
Right.
I mean, think about that. Your heart doesn't know how to function, your digestive system, circulatory system, endocrine system, none of that knows how to function without getting input from the brain. So, I mean, really, as far as chiropractors are concerned, what we do is remove the interference from the nervous system so your brain can effectively speak to the rest of the body. And upper cervical specific chiropractors, we take it one step further and make sure that gateway is completely open. So, when that goes out of alignment, I mean, you can see so many things, change. I mean, we have people that come in with jaw issues, with sleep apnea. I mean, it would actually change the way you breathe. We don't treat if there's a mechanical interference in that area. It's really as simple as that.
So, you're so knowledgeable in all of this. Can you share where you graduated, how long you've been in your practice, and just kind of a background on your expertise and your pathway to where you are now?
I graduated from Parker Chiropractic College. I guess it's Parker University now, in 2005. And so I've been in practice for 17 years now, going on 18. And through the course of everything that I've learned over time, I figured, what, I really want to be a ninja in the upper cervical world. So in 2016, I embarked on a 3-year program. Basically, it's through the board of the International Chiropractic Association of the Upper Cervical Council, in which I graduated with a DCCJP, or a diploma in chiropractic cranial cervical junctions procedures. So it's a mouthful, but basically I got a diplomate, which is extra letters after your name, of this area right here, C0, C1, C2, right there. So if I brought a model here so you can kind of visualize it. So this right here is the back of the head. So this will be here, okay? And if you're looking at it from right here, so this is the axis. And so this is it's the most neurologically, it's something that I have a great passion for. And now I have a more of a appreciation for how important this is for overall human health. So through this whole process of becoming a diplomate, I'm now on a couple of boards. So the International Chiropractic Association Upper Cervical Council, where I received my diplomate, they have people on boards and things. I'm a director for them. So we're actually putting together our annual forum. It's actually going to be here in Dallas, so it's quite exciting. I'll be the MC for that. And in October, orthosphinology, which is my particular technique, the upper cervical technique. If you have the upper cervical world as far as chiropractic, there's several different techniques that are underneath it. And orthosphinology is the technique that I practice. We're having our annual symposium in Clearwater this October, and I'm vice president of orthosphinology. So I've been part of that, I guess, for the past 6 months, a little over 6 months now, and we're putting together our symposium. I'll be speaking at that as well for doctors to come and get their continuing education credits as well. So I do a lot of speaking. I've been on that speaking kind of tour there through orthosphinology, I guess, for the past 4 years now, going on 5. So I'm pretty proud of that, helping doctors get their continuing education credits and being a part of putting that whole forum together.
In general, if you want to go into study for chiropractic studies, do all of the people who attend or study in this field, do they all learn that specifically? Or I know you just said that there are different techniques. Is there specialties within that field, I guess, that you can specifically study?
Yes. Now in school, there's only really a couple of schools right now, Life University and Sherman, that are really doing a great job in teaching their students the upper cervical work. However, most schools don't, so they may touch on it, or it's an elective, or maybe a club or something at the school. However, those two schools are the ones that are really just champions in teaching these particular techniques. It may not be all the techniques that they are studying, but at least they have a good grasp on making sure that students understand how important upper cervical care is. Many schools don't. So I think this is where we're lacking as far as the number of doctors that specialize in this particular technique. Really, there's about, out of the hundreds of thousands of chiropractors in the US and Canada alone, there's only about 1,200 of us that practice this upper cervical specialty, which is, we're really in dire need of more. So we're reaching out to students. We're hopefully getting a lot of students come to our upper cervical forum here in Dallas in June, and many more into the orthospinanology seminar in October in Clearwater. So that's probably our big now, is we don't have enough of us. And because although traditional chiropractic cases that involve vertebratic brain injury, there's so many getting helped right now in mainstream. And, you know, the traditional chiropractic, with the amount of damage that is done to this upper area right here, is very gentle. So this is where the upper cervical one really shines. So getting more doctors to learn about this through schools is something, again, the reason why I'm involved in these organizations through my own technique organization of orthospinanology, as well with the International Chiropractic Association Upper Cervical Council. It's imperative we get more doctors to do this, because there's too many people out there that need it.